Welcome everyone to the Pulmodyne webinar. Our goal here is to introduce you to the offerings that Pulmodyne has for the respiratory therapy department. It's an excellent call after you've called on anesthesia to then go down to respiratory and visit and identify what they're using now for their CPAP mask. I'm going to switch now to a PowerPoint presentation and we're going to try to see if we can let you see that. Let's see. Okay, hopefully you can see the PowerPoint presentation. And Pulmodyne, one of the key advantages of Pulmodyne is that they are an Indianapolis company. So they're a USA manufacturing company, and they make very high quality CPAP masks. What is CPAP? What is non-invasive ventilation? Basically in hospitals now, what they're trying to do is prevent you from being intubated. So they might start with a nasal cannula, they might start with then an oxygen mask, then at some point when they're worried that your saturation is still dropping and you're not breathing well, then they might put you on a CPAP mask, which stands for continuous positive airway pressure, or the other term is non-invasive ventilation. It basically is the delivery of ventilation support without the need for an endotracheal tube or a tracheostomy. So usually it's for patients that are pretty sick. So you have a device called a CPAP machine, and that's one of the things you want to identify as what machine a customer is using. We sell a circuit, and a circuit, just like an electronic circuit, connects the patient from to the ventilator, if you will, to the CPAP machine. This shows a BiPAP Vision, which is a very common BiPAP machine. But basically it connects a circuit to a mask, and the patient interfaces the mask. Pulmodyne sells both the circuit and the mask, and we want to go after both areas of business. A bi-level machine such as the Vision and V60, they deliver this non-invasive ventilation, and they deliver it through a mask and a circuit. It regulates the flow and maintains a certain pressure and basically keeps the patient from having to be intubated. So that's a key thing that we do. They can also use a standard ventilator to do BiPAP and CPAP, and that's why it's important for us to understand what the customer is using now with regards to a CPAP machine, because that can help us know what kind of mask we want to deliver them and what kind of circuit. Let's see. For some reason it's not going, not advancing. There we go. We sell predominantly single limb circuits, or we sell single limb circuits. So a single limb circuit is what is used to connect a CPAP mask to the BiPAP machine or CPAP machine. There are dual limb circuits. Those are more involved primarily in true ventilators when the patient is being ventilated through an endotracheal tube, for example. So most of the involvement we have with our circuits is single limb. In fact, Pulmodyne doesn't even sell a dual limb circuit. So all of our masks, our CPAP masks, will work on a single limb. The difference, though, is that sometimes the single limb has what's called a leak in the circuit, and sometimes the leak is in the mask. And we sell both. But that's one of the things you want to ask a customer is what kind of mask they use, take a picture of it, what kind of circuit they use, take a picture of it, get the product numbers, and that'll help us develop a strategy for selling our single limb circuit and our mask. Okay, so there are circuits, different lengths. They have the cap says, red cap says it's clean. They have swivel adapters. They may have an exhalation port. They're packaged 10 per case. Our circuits and our mask compare clinically, and we have a document that basically says that they compare to, for example, the ideal leak, etc., to a Philips mask. Philips and ResMed are kind of the market leaders, Philips being primarily the market leader. And our masks interact and react just as they are So we have studies that say, so occasionally you'll have someone that has Philips, for example, and they say, well, my ventilator says I have to use a Philips mask. Well, we have a document that tells them that they don't have to do that, basically. And that's kind of what these documents are, is telling them that our mask is compatible with the Philips mask. Logan, did you ever come on audibly? I still can't hear you, so you may have to unmute yourself. But anyway, these are the main masks that we sell. We have the full face mask, the shield type mask, and a nasal mask. Nasal mask is what most people are familiar with CPAP at home. In the operating room, or excuse me, in the hospital, you're mainly dealing with the full face mask, and that's the predominantly used one. And then occasionally you'll use the shield type mask. I'll show you samples of these because I have them here at my side, but basically we use these two masks sometimes on the same patient, because if a patient's on the full face mask for an extended period of time, there could be some areas of skin redness, and if they switch to the shield mask, it basically puts the pressure points on different locations. So we have a full line of masks with full face, shield type, and nasal mask. Our full face mask actually comes in two different flavors, so to speak. One has interchangeable elbows, and one of them has a fixed elbow. And we'll talk about elbows because that can get kind of confusing, but once again, the key thing is understanding what the customer is using now, what the hospital is using now. And if you know that, they're usually will tell you, oh, we're using a fixed elbow, or we're using interchangeable elbows. The only reason someone uses an interchangeable elbow, to my knowledge, is that if they know that they're going to take a patient from a CPAP machine to maybe a full-fledged ventilator, and sometimes the two different devices have different setups, and as a result, they might need a different elbow, and you don't have to get them a whole completely different mask. In my opinion, to keep it simple, the fixed elbow is our least expensive solution, and it's probably the simplest solution. However, making customers aware that we have interchangeable elbows and we have multiple interchangeable elbows is a competitive advantage. One of our big advantages is the fact that we have what's called an Omni clip. This is a silicone pressure release point for the forehead. Other companies use a foam that tries to reduce the pressure, and that foam can get oily and dirty over time, whereas our silicone is comfortable and can be cleaned and can be used for long period of times. The Omni clips also has multiple adjustments, both in and out and up and down, so it allows you to fit the customer or the patient ideally and most comfortably. So it reduces skin breakdown, and pressure also is and it just makes our mask fit better. But it's a competitive advantage because we use a silicone and multiple adjustments. The head straps, our head straps can be pulled off and can clip back on, and there's actually, if one of the clips breaks, the strap can run through this little opening here, and even if you don't have a clip, you can run the strap through there and still get a good seal for your patient. So it's kind of some of the masks, if you break the clip, you can't do anything about it, and the mask is done. This one, if you break a clip, you can still run the strap through it, so you don't need the clip if you don't need to. We have an anti-asphyxia elbow, and Logan, if you have audio capability, please come on and talk a little bit about how that is used. But basically, the anti-asphyxia elbow, if I'm correct, basically allows you to have the patient breathe if the machine somehow got turned off. So if the patient has a mask with a pretty good seal, and they all of a sudden the machine quits operating and quits delivering that that positive pressure, they'll still be able to breathe while they're being used with the mask on. So it's kind of a safety feature.
Hey Kevin, can you hear me?
This is the Max Shield. This actually covers the eyes, nose, and mouth. And you might think it almost looks like a fireman's shield, if you will. You might think that it would cover the face too much, but actually patients tell us that they feel less claustrophobic with this because they can see and even watch TV through this, and yet they get the comfort of that positive pressure. And once again, it's designed to be able to remove pressure points that the full face mask may have created on a patient. So they work in tandem with each other. Sometimes people use the Max Shield primarily in the emergency department, and the emergency department is a great area to investigate the opportunity for using a full face mask, such as the Max Shield in this case. So when you're talking to respiratory, you ask them what are they using in the emergency department. Are they using anything in the emergency department that's different from the respiratory department? And that'll help you understand what they're doing. This kind of, I don't know what this shows, but it basically shows using the Max Shield, and I guess there's a lot of positives to doing it. Let's read some of these. 72% of emergency departments have never used a Max Shield style mask, so they're not familiar with this. So even though this product has been out for a couple years, you have customers that have never seen it. And what's beautiful about the Max Shield is that it is really easy to fit a patient, whereas some of the full face masks are difficult to fit. The Max Shield will fit most everybody. 62% of respiratory therapists are not always present in the emergency room. So that means that a nurse or someone else has to fit the mask, and that's why the Max Shield should be better. 40% of respiratory therapists say it takes longer to initiate NIV in the ER compared to other clinical areas. I'm not sure why that would be. 92% of patients use NIV for more than 1 week after leaving the ED. These masks they can take home with them and continue to use, both full face and the Max Shield. 84% success rate with the Max Shield style mask for patients who are unable to tolerate nasal or oral nasal masks. So the Max Shield is something we need to be carrying around with us, making sure that the respiratory department and the emergency department know we have it. Nasal mask is not as big a sales opportunity for us, but be aware that's one of the masks we have, and it has a mask with a fixed standard elbow only. Obstructed sleep apnea is what OSA stands for. So a lot of times patients now, I don't know, there's been, the pendulum has swung back and forth. Sometimes hospitals used to encourage patients that are going to stay in the hospital overnight to bring in their sleep apnea machines, and now the pendulum swing in the other direction where they may not be allowed to bring theirs in because there's concern about liability in the hospital. So as a result, hospitals are using more and more nasal CPAP masks for supporting a patient that normally sleeps with support. So our Bitrek bi-level mask, we have a big selection of different things. I don't even know what that really says. Let's see, managing excessive air leaks. It's interesting, none of these masks need to seal to the point that they don't have a leak. So they all are designed to leak. So the pressure or the flow that these BiPAP and CPAP machines deliver is always more flow than the patient needs, and as a result, the devices are set up to leak. They're also set up to leak when you exhale so that there's room for the exhaled tidal volume or end-tidal CO2 to be released. So this shows you that air leak guidelines 0 to 6 would be too small of a leak. 7 to 25 liters per minute means that you have a good fit, and a 60 liter per minute leak means you're probably getting an alarm because you have too big of a leak. So the point is these masks are not designed to be completely sealed. They're designed to have leak built into them.
Hey Kevin, can you hear me?
Yeah, hey Logan.
Hey, sorry about that everyone. Finally figured it out.
Well, I need you to speak up a little bit so we can hear you. If you have any comments as I'm going through this, please, chime in.
Yeah, for sure. So on that last slide, I did want to say one thing. So as Kevin mentioned, the Vision is a BiPAP machine that is commonly used, and more commonly, Philips' new version is called the V60. As you can see, the 60 liters per minute here, the whole premise behind the V60 is so that it displays less than 60 liters per minute of leak, and our masks are used, as Kevin said, interchangeably with those Philips disposables. As far as adjustments on the mask to fit in the parameters of the leak, Kevin mentioned we have a dual lip style cushion. So one thing that is really unique about our product that Philips has too, but all other manufacturers don't, is that if you want to reduce leak rates, you actually loosen the mask so that it doesn't disrupt the bubble seal. So that's the one thing I want to say there, Kevin.
Okay, great. Here we are into some 3 components of success. Logan, once again, if you're more familiar with this, just please speak up, speak a little louder, and I think we'll all be helpful to it. I'm not positive I want to go too deep into fitting the patient because that's important, but we need to go through step 1, which is identifying possible opportunities. The point is, I think I would like to make is our mask fit equally as well as Philips mask, and although that's an important thing, we have lots of features within our mask that allows our mask to be one of the more flexible and yet ideally fitting masks available.
Yeah, as far as the fitting goes, the only thing I want to touch on there is, which is one of our big competitive advantages, which seems kind of small. I didn't catch if you talked about it already, Kevin, but if you did, feel free to stop me. Our headgear actually has a second set of Velcro, and this is a really great feature for any of those maybe older ladies in the hospitals who have really small heads. One of the things that respiratory therapists are doing is they're having to crisscross the straps. And we were able to come up with a solution to that problem by putting in the second set of Velcro, where you can just shimmy the clip down, use the second set of Velcro, and then cut off about 3 inches of the strap on each side. So it's really making respiratory therapists' life a lot easier, as well as a better patient fit and comfort level.
I think the slide that was showing there shows a little bit about how it's fit and how it's adjustable. I think the key thing to know is that Pulmodyne has multiple adjustments, like Logan just said. This shows fitting of the Max Shield, and once again, we're not going to go over the step-by-step steps of that because you can read it yourself, but the point is we have multiple adjustments, multiple Velcro straps, and we do it, if not better, as equally good as everyone does, and probably better. This shows, what do they call this? This is the bitrack.
That's called our shield mask, or more commonly known as the Jason mask. We don't do a ton with this. It's a one-size-fits-all kind of thing. It's a lot more expensive than the Max Shield. So honestly, I would focus on the Max Shield rather than this. But it is a good mask if they have any facial abnormalities. But in general, people aren't going to order too much of these ones.
Okay, to talk about competition, the point is there is competition. Most of the marketplace that I see out there is Philips, probably predominantly in the marketplace, and then I see Fisher, Paykel, and ResMed, and I guess I see CareFusion. I have not seen Hans Rudolph yet. What would you comment on this, Logan?
I would say Fisher, Paykel, and Philips Respironics are the 2 that you guys need to really worry about. Philips has about, I don't know, Kevin, what do you think, 80% of the market share, it seems like?
Probably. Philips bought Respironics, and they were a market leader.
Right. So I would say 8 out of 10 times you're going to run into Philips as what they're currently using. Fisher Paykel is the second place winner there, and ResMed's kind of they're the third player that we're worried about, but we run into them so few. The first 2 are the ones that we're worried about.
Now, I will tell you, we see a lot of ResMed in the Northwest. And I think that's an opportunity for the folks in the Northwest. But anywhere where ResMed has been strong is probably a good opportunity for you. So the key, once again, in being successful this is making a call on respiratory therapy and asking them what are they using for CPAP mask and also circuits. So we got to identify that. This shows a Philips mask. I actually have one in my office, so I'll show it to you. But the picture doesn't do it justice, so I'll try to show it to you later. This shows a Fisher-Paykel mask. Logan, you want to make a comment about this? It has that metal wire on it that's adjustable, I guess.
So the Fisher-Paykel mask, there's one main thing that people like about this mask, and it's really the only reason they use it. The cushion, as you can maybe tell from the picture, is actually extended to go underneath the chin, and that's a good feature for any patients with beards, or maybe they've had mouth cancer and maybe an abnormal face shape. It's a good mask for that. But other than that, it really doesn't have much advantages over us. The adjustability in the forehead piece is non-existent. All it is a silicone loop that's meant to rest against the forehead, and what we've found is that a lot of times it won't even touch the forehead, so it's really not that great of a fit for patients. But other than that, there's really not too much to worry about with this mask other than the cushion shape.
And be aware that Pulmodyne does have 4 different cushion shapes that include one that goes underneath the chin. So if someone's using Fisher-Paykel and the main reason they're using it is because of that under the chin, we have a solution for them. This is the ResMed. Do you want to make a comment on this, Logan?
The ResMed one has no what I would call clinical advantages over ours. There's really no adjustability. The one thing that people seem to maybe like is the swivel on the elbow here. We have the same kind of thing, but yeah, this one I've run into. I've been doing it for a year and a half now, so I've run into it less than probably 5 times in my career. So it's not big for us, but like Kevin said, I have seen it in the Pacific Northwest.
And did CareFusion buy someone whose mask is this?
That's Viair.
Okay. So they're a player also, and there's the Hans Rudolph. I guess one of the things I would tell you is that if you are interested in promoting Pulmodyne, and we want you to be, Logan will get you a demo kit that you can carry around that has all the different mask shapes, cushion shapes, if you will, and a basic little bag that is your Pulmodyne bag, and with extra elbows and things like that. So please reach out, and I'll send everyone Logan's email and phone number, and you can reach out, and he'll send you your basic demo kit, which is really pretty nice to have. I'm going to switch back to, I think, live, but I don't know if I'm good at this. Stop sharing. I don't know. Logan, do you know if you're looking at it? Can you actually see me pretty big? Or?
Yeah, well, I can see you.
Okay, well, hopefully it's so I'm holding up the live version of our Pulmodyne mask, and this shows the silicone forehead shield and the Omni clip. There's multiple adjustments. It can go in, out, up, and down, so it'll fit almost everybody's forehead. This shows our double cushion face or cushion mask. So it has this is similar in design, if I'm correct, Logan, to the Philips.
Right.
It's a more comfortable and a better seal. Yet once again, it meets the specifications of Philips, and it meets the specifications of the Vision machine. So, it has multiple straps, and the straps have hooks that go on real easy, or clamps, I should say. And once again, if a clip breaks, we can thread the strap through this opening here, and they don't have to throw away the mask. Most people, when you put this mask in their hands that have been using anything else, will find that it's an acceptable, if not preferred, mask with some nice features. We also make it with an interchangeable elbow. Logan, why don't you talk a little bit about the interchangeable elbows, when you need it and when you don't need it. I've talked a little bit about the fixed elbow being a little simpler to me and less expensive from Pulmodyne. And I would say myself is, once again, you ask the customer what are they using now. If they're using a certain product that's a fixed elbow, you would let them know that we have multiple elbows on our non-fixed system, but I'd start off with competing head-to-head because we have good features there. And then if they have the need to have interchangeable elbows, then once again we have that also, and they could buy that separate mask for those individual situations. But Logan, take a moment, if you will, and speak up on the differences with the elbows. I'll try to show some of the elbows.
Okay, so the majority of our customers are going to be using the clear anti-asphyxia elbow. In general, kind of, I would say probably about 80% of them are going to be using the fixed version of that. Now, we do have interchangeable elbows for a couple of reasons. We realize that people have all different kinds of needs as far as therapy. We have nebulization elbows that are safe to use on the V60, and that's the, Kevin, that's the, if you have the blue one with the little, the neb port on top of it. So that's a nebulization elbow that's meant to use on a standard vent. Now, Kevin, if you have the clear one with that little same cap on it, that's our anti-asphyxia elbow with the nebulization capability. One thing to note about our neb elbows is that we're the only manufacturer on the market that lets the adapters of the Nevo and the Solo adapters, which are just adapters for the Aerogen, to be accepted directly into the elbow. So what some people are having to do is put the adapter down on the edge or on the end of the circuit, and then all that nebulized medication has to travel through the circuit, through the elbow, and then into the mask to be delivered. So it's kind of nice that our medication doesn't need to travel that far to be administered.
So just so you know, and Logan, maybe you can expound on Aerogen, but Aerogen is a relatively expensive hardware device that assists in delivering nebulized treatments, and it's a reusable device, and that's why it'll plug into here. So if they're investing in Aerogen, they really are trying to give good treatments, and our elbows help that. So one of the questions, and I'm going to try to ask Logan to come up with the top 6 questions, or maybe top 3 or top 10 on what to ask a customer. But one of them would be, do you use Aerogen nebulizers? Am I correct, Logan?
That's right. Yeah, we do have a huge advantage there. So they'll be happy to hear that we can accept both the Nevo and the Solo adapter when it comes to the Aerogen.
Okay. Anything else on elbows we need to know?
One thing that kind of sets us apart from the competition, I know I said we have every therapy out there. We also have one completely unique Pulmodyne product, which is the anti-asphyxia bronchoscopy elbow, the one you have in your right hand there, Kevin. Yep, that one. So that's a completely unique Pulmodyne product, and what that allows is you to the capability of doing a bronchoscopy on a BiPAP machine. So again, that's going to be the V60 or less commonly the Vision, as Kevin was saying.
Okay, so basically a flexible scope would go through there, and they can do some kind of observation of a patient while they're giving them CPAP, correct?
That's right, and more importantly, it's while they're giving them BiPAP. So on that V60, the other green one, the kind of more standard green one, that's a standard bronchoscopy elbow that's safe to use on the standard ventilators, and other people have that one. So if they wanted to do a bronchoscopy while they were on BiPAP, they would actually have to switch them for other manufacturers over to a standard vent, use that green elbow, and it's just a lot more hassle moving them to a different machine.
So we have more interchangeable elbows than anyone, so that's an advantage of us. And we work with this Aerogen nebulizer. But once again, if the customer's using a fixed elbow right now, there's no reason why we wouldn't be proud to show our mask and have competitive price advantages and features to beat them with that. But the reason they want those interchangeable elbows or have the option of them is that it allows them to reduce their inventory of different mask types. So just be aware that's the whole idea of the disposable or interchangeable elbows, is that I can take a mask that I might be using with a CPAP machine, and then I can transfer the patient up to the ICU and put them on a full-fledged ventilator. Well, that would take a different mask elbow, and if I have interchangeable elbows, I don't have to burn another mask. So either way we can do it the way they're doing it now, or we can use interchangeable elbows. I'm going to just show you real quickly. This is the MAC shield, and it closes both eyes, nose, and mouth. Yet I can see out of it very easily, and I could watch TV or whatever. And once again, the key advantage of it is that it disperses the pressure points in different spots. So that's one of the advantages. The other is that it fits. It's easier to fit for somebody. If you have somebody in the emergency department that is coming in with an asthma attack, you need to get them relief right away. And this could be relief that could be done in seconds, versus fitting a CPAP mask might take a minute or two. Logan, do you want to make any comments on that?
Yeah, just to kind of say something else about the MAC shield. It's a really good mask, as Kevin said, to put them on in the ED when they're in a lot of respiratory distress. You get a mask on them quick. The size large fits about 80% of the population. So that's definitely a good option, rather than struggling through the sizing process of maybe the oral nasal mask. Yeah, it's a great option to disperse that pressure. And also, some of these people that are coming through the ED, they're nightly CPAP users at home, so they may already have some redness on the bridge of the nose. I know Kevin said it, but this is what you'll run into at every single hospital you're going to. You're going to find that their main concern is skin breakdown, skin erosion, pressure on the bridge of the nose. So if you see someone coming through the ED who's clearly a nightly user of their CPAP mask, it might be a good idea to avoid a potential problem and throw them on that mask right from the beginning, so you don't put any additional pressure right where they've clearly been putting the pressure.
This is a little thing that shows the 4 different shapes of cushions that Pulmodyne has, and this is the shape that goes underneath the chin. I think it is. And maybe it's this one. At any rate, we have them all. I'm going to talk, make a change a little bit here. I have Jerry Keaton and Mike Luters hopefully online. Both of them have had a little bit more experience on selling these CPAP masks, and they can give us some insight and some success stories. Michael and Logan have worked together and closed 2 accounts in the last 45 days, and Jerry's working on an account that sounds like it's got some big potential. Before I turn those guys on, I want to make sure everybody knows this is one of the few accounts we have a contract, a premier contract, and the premier pricing is very aggressive, and Logan and Bob, the folks we work with at Pulmodyne, are willing and able to give us the higher level tier pricing for any competitive situation. So I believe Pulmodyne is kind of a perfect product for Bell Medical, because the device itself has 3 to 5 to 7 advantages over our competition from a design standpoint and usability and option standpoint. And now we have this premier contract that gives us a significant pricing advantage, especially over Philips and Fisher Paykel. So you are going into an account with a superior product at a cost savings, and that's usually 2 legs of a stool that you need, and then sampling and pricing and all that kind of stuff they can help us with, can get us over the finish line. So Jerry, if you're on the line, why don't you talk for just 60 seconds or so and tell us about the opportunity that you have and any experience you can give us with regards to selling these masks. You have to go off mute. Michael, if you're on, I know you're driving in a car with family. If you could come on and talk to us about the 2 accounts you converted in the last 45 days. I think you have to go off mute. Maybe I can control that. Uh,
Can you hear me?
Okay, I've just unmuted you, so now I can hear you, and I've unmuted everybody. So if we'll see how that works. Michael, can you tell us about your recent successes?
Yeah, so I'd just like to say to all the reps that I really do think this product is worth your time. It really meets 3 criteria that I kind of look for products that I'm going to be successful with. 1, it's clinically preferred. 2, it provides extra patient safety to the patients. And 3, and most importantly, it provides the opportunity for savings for the hospital. What I've done, I've had some recent success with a couple accounts, but I targeted my independent hospitals because I knew with a product like this, if I could get the respiratory therapy department on board, it would be quicker moving after that. My experience with respiratory therapy has been that they're easier to set up appointments with anesthesia, but it's harder to get them to actually do something. It requires more follow-up. So I set up initial appointments with these accounts, gained some interest just by pointing out a few things about the mask clinically, that the forehead piece seems to be superior from Philips Respironics, that it's silicone, that it has more maneuverability as far as it moves up and down and side to side, where the Philips mask just moves on a crescent shape. They really like that. Another thing that Logan mentioned that seems small, but everywhere I've gone they really like, is the double sets of Velcro on the straps. Apparently that's a pretty big issue and can be a pretty big pain in the butt for respiratory therapists if their patient has a small head. And the double sets of Velcro, that gets them to light up every single time. Also the dual limb cushion, they really like that. The bridge on our mask across the nose seems to be a little wider, which is where almost all of the skin breakdown problems are. They see that immediately and they like it. So right off the bat, without being a complete expert on the product, you can point out 3 or 4 things that clearly to every RT they're gonna see that and say, wow, that makes sense, that's better. Then you tell the director, oh, and by the way, we're looking at probably saving you upwards of 20% on your costs on an item that they have a pretty good spend on. There's going to be some interest garnered there. At that point, I try to set up a trial, and I bring Logan or Bob down, and then they really dig into the elbows they're using, the limbs they're using, and really help push the sale along. They give me all the information I need to quote the account accurately, and then at that point, it just takes a lot of follow-up. Both of these accounts, it didn't happen overnight. It probably took touching the client, with voicemails or emails or drop-ins, 10 to 15 times. But now they're both ordering and they're both happy. And I really think that, this is a product similar to Amzor Plus or Mindray, where it has several huge advantages, or you get several arrows that you could shoot out at them as far as why this product is better than what they're currently using, why it's less expensive, provides better patient safety, and it's a product ultimately that I think everyone can have success with.
Hey, Michael, how did your situations actually start? Did you just make a cold call on respiratory, or were you in a hospital and had made an appointment with them? How did you get that first ball rolling? What was the questions you asked?
Well, I think it was a mixture of, making calls on the phone, giving them heads up that I was going to be in the area and stopping by. In my experience, you can get the respiratory therapy director on the phone by making a phone call to the hospital. They're at their desk more than anesthesia is, obviously. But you can also drop in on them, and they're relatively open to that kind of a call. I think maybe they might be used to getting called on a lot because there's so many suppliers for nebulizers and things like that. But it doesn't matter whether you're cold calling or setting it up from a phone. It seems to be a little bit easier than setting up meetings with anesthesia either way. And then, like I said, you don't need to be a complete expert on the product and know all 20 advantages. If you can really hit on and key in on, 4 or 5 of the big advantages that are really plain and easy to see, that's going to get you enough to set up a follow-up appointment or a trial. And Logan's great. He'll fly in and help you out wherever you are, spend as much time as you need with the account to get it done.
Okay, so I think the message I got from there is that you don't have to be an expert in CPAP masks to sell these. but you do need to get in front of the customer and make them aware of the product that you do have that is possibly superior to what they're using. So my recommendations is to make respiratory therapy aware that you're going to be in their hospital. Go by and visit them, or even leave a message with them and just say, hey, I'm going to be in the hospital, I'm going to stop on by to introduce myself. Then when you go in there, even if you can't meet the director of respiratory therapy, you want to ask one of the respiratory therapists, can you see the different CPAP masks that the department is using now? And take a picture of them. Make sure you see the product number, because Logan and I can look up the product number and we can understand what they're using. Also, ask for circuits. Ask what circuit they're using for their CPAP mask. And it's always a single limb circuit. But once again, take a picture of it and identify the product number, and then we'll know what we can quote them. Logan gives us very aggressive pricing where we are able to give the customer very aggressive pricing, but we still make 25% gross profit. So it's a great opportunity when you're working with Logan. Logan, do you want to add anything to that?
Hey, Kevin, I'll add one more thing. Philips Respirana came out with a new mask, within the last 9 months or so. So they're presenting this new mask to a lot of their clients, and what that's doing is it's getting those respiratory therapy departments to look at other masks. So if they're going to trial the new Philips mask, now's a good time to get in there and say, hey, if you're doing that, why don't you trial our mask? We'll save you, 25% on what you're paying for your Philips mask. And the Philips mask does have some nice features to it. It's extremely expensive. And there's no reason why they can't use that mask in conjunction with the Pulmodyne mask as well. They have one that goes under the nose, which they like. Well, you could use that mask if your patient is having any issues with skin breakdown, but why go straight to that mask since it's so expensive if you don't have to? So what I'm saying is now is the time to get out there in front of the RTs, because they are looking at the new Philips mask, and that gives you an open door to get your product in for trial as well.
Hey, Michael, last question. The revenue, maybe it's been a little early, but have you noticed the increased commission as a result of these conversions? Is it pretty good revenue?
Yeah, I mean, the volume is definitely great, and if you can get a good-sized hospital, it's a big spend for the RT's departments. It's probably one of their larger spends, that nebulizers. I don't know if it's more or less than nebulizers, but it's a big spend for that department. And if you can go in and tell a director that you could cut 25% or 20% off of that area, you're not going to find many that aren't going to listen to you or at least agree to meet with you. So it's a great product and great potential for everyone out at the time.
Okay, well, I appreciate that.
This is Jerry.
Hey, Jerry Keaton from Kansas City. Thank you, Jerry. Speak up, please.
Can you hear me all right now?
Barely.
Okay, I got my phone up as high as it'll go. I totally agree with what Mike had to say, and I just wanted to say a couple of other little things. When you get to talking about the fixed elbow versus interchangeable elbows, what I have found is most of your medium to smaller size hospitals, they will be content with a fixed elbow. If you get into the big university hospitals and large institutions, they're going to be more interested probably in the interchangeable, because they're going to be doing more things in more departments. So just prepare yourself for that. To me, the big thing is just recently this year we had changes to two important features, the OmniClip and then the straps. And if you talk to the respiratory department and they say, oh, no, I don't like Pulmodyne, I've tried it, you need to say, well, we've made some changes, and that will get you in. And I have found that two accounts, Truman Medical Center, they were not happy with the first trial that they did, and Logan and I went back in and showed them the new features of that, and they they're now in agreement to do, well, they're ready to go. It's a matter of getting it through purchasing now with the correct numbers and everything. It definitely made a big difference with those improvements.
Thank you, Jerry. I appreciate it.
Yeah, okay.
And Kevin, I'll just add one last thing. For me, at least, the quoting process can be a little bit overwhelming because there's such a various amount of circuits and elbow options and mask styles and cushion styles. I would recommend that you work closely with Logan when you're doing your quotes to make sure that you're quoting the proper mask, proper elbows and circuits for your customer, because it really isn't as cumbersome as it may appear at first glance. And once you do that with him once or twice, it's really pretty easy.
Thank you, guys. Logan, do you want to add anything to that?
You know, just with what Mike said, we have a lot. Obviously, the interchangeable elbows with the different masks means a lot of different SKUs, and I know it can be overwhelming. I know every single one of them. So, again, with what we said earlier, as long as you can get the circuit information that they're currently using, whether it's a vented or a non-vented circuit, I'll be able to figure out which kind of mask would be best for them, especially if we're going to be sending them sample product. I know Kevin is, I think you said it earlier, but we're very generous with our sample policy. If you guys can get into these accounts and they're interested in it, Pulmodyne does a great job of providing whatever samples they need so they can conduct a thorough trial. We're really confident with our masks, and we know that once they see the price savings, they conduct a trial. We have no issues getting into these places, so we're very motivated to do that.
I just might add a little something. Now, this is getting a little far advanced, but when you actually do an evaluation, let me know, because I'll support it by giving you maybe $3 to $5, $10 gift cards to Subway, for example, or Starbucks, because being able to give them a small incentive to take the mask that they're currently used to off of a patient and put our mask on it takes work for them, and that small gift gets it done. So we've had some experience with that. So when we actually work so hard to the point that we get an evaluation, I've had situations where the therapists don't make the effort to put our mask on, and that's where it stalls. So what we want to do is we want to go in there and actually walk with the patient or walk with the therapist and have them encourage them to change the mask for the patient, and then we give them a gift card. So keep that in mind. Hopefully you can see, like right now we have Pulmodyne BiTrack NIV mask on the on your display. Can anyone see that?
Yeah.
Okay, good. That's our Road to Success document, and this is our list pricing. So this is not our Premier pricing, Tier 4 pricing, which we do have access to. I'll share that with you in a minute. But the way this is set up is we have the mask, and this is another point, is we have an extra size that most people don't have. So we have an extra large, and a small adult. But this is the way our Road to Success is laid out. It shows some of the elbows. It shows, here's the circuit information, and it talks about a circuit with a filter or without a filter. Those are questions you want to ask. But once again, you can accomplish it by saying, show me what you're using now, and take pictures of the product number and the product. But when I would recommend going in and selling circuits. You know, they wouldn't even need to do a trial on circuits because they're really going to be buying based on price, and we can probably get them to buy our circuit, and then the next step would be to go after their mask business. But you need to know whether they're using it with a filter or without a filter, and then they need to know whether the circuit is vented or non-vented. In other words, that means...
I'd add just something quick on the pricing. Work with Logan whenever you have an opportunity or a customer that's interested in Pulmodyne regarding pricing. If it's a hospital that has decent or large usage, they will give us they will extend lower pricing to us so that we can extend lower pricing to the client and still maintain above a 30% profit margin. So for strategic accounts that have larger volumes, they actually supply us with better pricing so we can extend that to the customer, but at the same time maintain our profit margin. So make sure you keep Logan in the loop on any pricing issues with accounts you're working with.
Well, every customer is going to have pricing issues, so when I present this, I would present this as our list pricing, and our list pricing is actually good. But then when we learn more about their volumes or their situation, once again, Logan can help us get pricing. So we will be able to go into an account and we can guarantee them savings. So don't be shy about that. So once again, find out what they're using now, and then we can get the pricing from them. I think I also have, this shows all the different elbows. This is another road to success on our full face. Shows all the different elbows. Once again, this is all of our list pricing. Does anybody, well, I'm going to go through a couple questions that I saw here. We do not go after the home care market at this time. I do like Darren's suggestion that we might get pictures of our device with an Aerogen. So Logan, maybe you can do that for us.
Yep.
Obviously, Logan mentioned we have a premier contract, and that pricing is very aggressive. And I believe we can get premier pricing for even a non-premier hospital if the volume's high enough. So that's the big GPO, if you will, is premier. So we have in the past sent out listings of premier hospitals in your territory. We can probably do that again. So be aware of that. Okay. I'm going to switch gears very quickly to control crike, and I'm really just going to show our one, this is our road to success for the control crike. The control crike is another product of Pulmodyne. It is something that could be sold to respiratory, but it could also be sold to anesthesia, could also be sold to whoever's in charge of someone's crash carts, could be sold to emergency department. We have this everywhere, so we can sell the control crike all across the U.S. And since our call is already almost approaching an hour, I'm not going to go into it in too deep detail, but I will send you out this flyer, if you will, our Road to Success, that does have a video that talks about the advantages and how it's used. But I will tell you, it is, whenever we show it at a show or wherever I show it to anybody, they are all impressed by the fact that we integrate this crike key, if you will, with the blade, and they're always impressed that we integrate this, I'm going to call it a bougie or into the trach itself. They make the trach system so much easier, and you'll see that in the video. Logan, do you want to take 2 minutes and talk about the control crike and just make people aware of it?
Yeah, so the cool thing about this product is that it has clear clinical advantages. You'd be surprised how many times I've shown this at a trade show, and it's very intuitive. People know exactly how to do it, but like I said, it's very different than what they may be used to. The first thing, like Kevin said, is the integrated tracheal hook in the knife. It's the only thing, or the only device out there that has that. This is a very chaotic procedure. If one doctor does it one time in their entire life, that's kind of a lot. So it's a worst case scenario procedure where you cannot intubate, you cannot ventilate, so you have to surgically or put in a cricothyrotomy kit. And so imagine in the movies they have. Just kind of to tell you what it is, I'm sure most of you have seen the movies where they shove a ballpoint pen into their throat, and then that gives them the ability to breathe. That's the basic version of what this is. So again, it's laid out with very easy to understand packaging. It has step 1, step 2, and step 3. Step 1 is this first, the knife with the integrated tracheal hook. Step 2, as Kevin mentioned, is the tube itself with the rigid stylet that acts as a bougie. And from cut to airway, it's about 30 seconds, which in these kind of circumstances, time is everything. So it's a very quick procedure. Again, it is very chaotic, so we need something very, very intuitive so that it doesn't leave anything up for guessing, because people may not be trained on this very well. It's very seldomly done, so they don't do a ton of training with it.
Our biggest competitor is Cook, and they have a device that I think has a 2-year shelf life. It sells for around $450. Ours is $200 and has a 5-year shelf life. So we destroy the competition from a value standpoint.
Logan,
That's right.
Why don't you talk about the Providence trials and also the basically the workshop at the Washington CRNA meeting?
Yeah, so Jim and I went up to Washington, specifically targeting the Providence system. It was really nice. They actually approached us. They saw this being demoed somewhere. They saw clear clinical advantages. They just wanted to see it put to use on pig trachs in their workshop. So what Jim and I did, we went up there. How many times, Jim? 2, 3? Three times. And now what it's looking like, which Jim, I have an update for you, which we can talk after the call. But it's looking like it's going to be adopted by several of the facilities, if not the entire system. The one thing about this product is a lot of times it's a waiting game. It's so seldomly done. We have a 5-year shelf life. Like Kevin said, the competition is 2. So what they typically do is you wait for it to expire and then you reorder it, because hopefully they're not even doing these procedures. But it's a timing product. It seems like Providence is ready to kind of make the step towards this, and it was a really good few meetings up there in Providence.
Logan, would you say the control crike is a lead for respiratory, or what department would be the lead?
Nope. So there's 2 main call points for this. The first one is anesthesia, and the second one is in the emergency department. So respiratory, they'll know what this is, but nobody in respiratory would have any decision-making power or know how to even really do this procedure. So anesthesia and in the emergency department is the best place to do it.
Okay. Well, we're at about an hour into this. I appreciate everybody's attention the day before Thanksgiving, and thank you, Logan, for assisting us and offering us assistance. I do believe I will send out Logan's email and phone number to everybody. Please reach out to him. Ask him if you can market in the state you're in, because I know some of the states people might be on, we may not have exclusive capability. He's granted us non-exclusive capability in multiple states like Texas, and I think if we do a good job, for example, in those non-exclusive states, then we can convert them to an exclusive arrangement. So I believe the opportunities are out there. I know Pulmodyne's hungry for new business, and they'll work with anybody that's trying to work with them. Everybody have a great Thanksgiving. Thank you.